So my name is Philipp Lurz. I'm a cardiologist at Heart Center Leipzig at University Leipzig. There's a huge proportion of patients with arterial hypertension with actually quite poor blood pressure control, despite the intake of several different antihypertensive drugs. And one alternative approach to these patients and treatment option might be a device-based therapy for arterial hypertension, which is renal denervation. And despite the fact that the latest trials are quite positive and promising, demonstrating superiority of renal denervation as compared to a sham procedure, the non-responder rate in all of these trials was still about 1/3 of patients. And the aim of our trial was to improve patient selection and find predictors for response and non-response to renal denervation in patients with uncontrolled hypertension. We looked at response to renal denervation, which was defined by a reduction in daytime systolic blood pressure on ABPM of at least 5 millimeters of mercury. And we applied three methods to assess arterial stiffness, because there's some preliminary data suggesting that arterial stiffness is a good predictor for response to renal denervation, meaning that those with very high arterial stiffness might not respond as well as those with less arterial stiffness and a more preserved arterial compliance. So we assess arterial compliance and arterial stiffness by three different methods: invasively, by calculating pulse wave velocity, that's considered to be the reference standard. Then we use the non-invasive method, the complier system, with a blood pressure tracing non-invasively with electrodes placed on the femoral artery and the carotid artery. And then the third method was magnetic resonance imaging, looking again at pulse wave velocity, but also on aortic distensibility as a marker for arterial stiffness. So the key results are, first, we again could confirm that invasively assessed pulse wave velocity as an estimate of arterial stiffness is a quite good predictor for response to renal denervation. But we could also show that also non-invasive measures of pulse wave velocity and arterial stiffness help to predict the response to renal denervation, especially cardiac magnetic resonance, looking at arterial distensibility. And when we combine that with some clinical data, the predictive value is quite high, with an area under the curve close to 0.9. So the conclusion would be that arterial stiffness matters when selecting patients for renal denervation. Invasive measurement of arterial stiffness is probably the reference standard, but is less suitable as a screening and patient selection tool. Cardiac magnetic resonance might be very powerful to select those patients who benefit the most from renal denervation. So the next steps would be to apply these methods and evaluate their role in a prospective manner.